Good morning, and it's my pleasure to be here presenting on the virtual platform Bridge Gaps in Specialist Training in this Future of Urology Training in South Asia SLOUS Symposium. And I'm really grateful to the organizers of the 58th USICON for this very kind invitation, and particularly to Professor Srinath for giving me this opportunity. My name is Hammad Ather. I'm Professor of Urology at USICON University in Karachi and currently President of the Pakistan. Urology, since its independence from general surgery, has grown rapidly over the past 50 years. It has developed itself into a huge specialty with many subspecialty, which in itself are independent disciplines. This includes endourology, uro-oncology, female and functional urology, pediatric urology, andrology, reconstruction, etc. But the most important thing, and we have to train our trainees not only in general urology, but into these subspecialties, which probably is out of the domain of most residency training program. Definitely, it requires fellowship training to get the real insight into these disciplines. The subspecialties training is important, but even more important is to inculcate into the residents a thinking mind, a questioning mind, which is the essence of science. Something that Hippocrates said more than 2,400 years back, that one must attend in medical practice not primarily to plausible theories, but to experience combined with reason. So this is the basis of practice of medicine. Something that is formalized by Dave Sackett, the Canadian physician who is the father of evidence-based practice. Now, majority of the components of the SAARC countries are in the process of developing fellowship programs, and they're not very formally there, but the help from some of the international organizations like Société Internationale de Urologie, European Association, World Congress, and the PAUS have made a significant contribution in training residents not only from the Western world but also from our part of the world, getting first-class training via short rotations, fellowships, and elective programs. What happened 3-4 years back is that pandemic, which has resulted in the loss of millions of lives. Now, this was indeed a catastrophe. However, every adversity, every failure, every health heartache comes with it the seed of an equal and greater benefit. And the only benefit that I see for medicine is that we are able to develop online platforms and create opportunities for online training. Just a brief description of what we are doing in PAUS. Well, we have Karachi Urology Week, which ran for over 15 years, in which residents from all around Pakistan come and join us in Karachi and rotate in various institutions where live operating sessions and didactic teaching sessions are held. We've been holding the conceptual basis of urology course for over 4 years now. Over 50 webinars on various contemporary topics have been discussed. And more recently, we started a certification course in uro-oncology, which will run for 1 year and which has over 40 international speakers. So these and some of the other opportunities which are there, which are created by SOUS and some of the other organizations, are important in our region. Well, surgical training has taken a big leap, a paradigm shift from William Halstead's time to the virtual simulation-based training. So his principle of see one, do one, teach one is no longer the trend in training residents, surgical residents. Now, why we need these virtual platform is, number one, that the patient safety is important. There is increasing number of trainees, and it's not possible to give a good quality hands-on experience at most centers. Clinicians are overworked. So simulation-based education is the key to most of these problems. It is not going to replace, and it has not replaced in-person training. It's an adjunct to the real-life training. It provides a controlled real-life environment, which is important for teaching residents. Not only the technical skills or psychomotor skills are learned by the surgeons, urologists, but also the behavioral and non-technical skills can also be learned. The pros of simulation-based training includes improving the psychomotor skills. Residents can rehearse, or fellows can rehearse complex surgical procedure, which happens once in a while, and most will not be able to get an experience in dealing with that situation. So besides the technical skills, the behavioral skills, which includes skills in communication, teamwork, and decision making, can also be learned through these various platforms and boot camps. Telesimulation is a more recent introduction to our learning platform, and remote location or simulation-based medical care and medical education is imparted by world experts. Well, it uses virtual as well as augmented reality. It's a cost-effective alternative to physical simulation, which is extremely important in our part of the world, where due to lack of resources, it is not easy to have high-quality virtual reality simulators. So still, a lot of us are teaching in a didactic method, bedside teaching, and in peroperative learning. This is how most of our residents are trained. The question really is, why not we can move into the realm of the simulation-based training as is being done in the West? Well, the reasons include absence of context-specific simulation curricula, something that can be easily developed, and there are models available. Competing clinical priorities, something because of the different types of financial models in clinical practice, limited resource for capacity building, lack of skilled simulation instructors, and inadequate financial support. So see, these are some of the, most of these are surmountable. They can easily be overcome. However, it requires concentric effort. So moving from this amphitheater operating room, we have taken a real paradigm shift, and now majority of the training is done through the video cameras, and now we have moved into the realm of robotic surgery. So before I conclude, ladies and gentlemen, I'll just narrate an interesting story to you. Well, a group of scientists placed 5 monkeys in a cage, and in the middle a ladder with bananas on the top. The natural tendency was obviously that the monkey will climb up the ladder to fetch the bananas, but whenever this monkey goes up, the other monkeys are showered with cold water. After a while, every time a monkey went up the ladder, the others beat up one on the ladder. So after some time, no monkey dared to go up the ladder regardless of the temptation. Now the scientist replaced one of the monkeys with a new monkey. However, when this new monkey tries to go up the ladder, the others would start beating. So this monkey has also learned that going up ladder is not sensible. So one after the other, all the monkeys were replaced, and they have never received a cold shower, but they don't dare go up the ladder. So what was really left is 5 monkeys who never received a cold shower, continued to beat up any monkey who attempted to climb up the ladder. If it was possible to ask the monkeys why they would beat up all those who attempted to go up the ladder, I bet the answer would be, I don't know. That's how things are done around here. Doesn't it sound similar? That's the way we work as surgeons. We need to be more scientists. We need to ask questions, change paradigms. So, in conclusion, ladies and gentlemen, virtual platforms are an adjunct to in-person training, which can not be replaced. Live surgeries are there, they are important. However, there are some serious questions about live surgery, and semi-live surgery is probably a better option. Low fidelity simulators, as is developed by Professor Srinath, for many procedures, and they're there for various procedures that can be learned, is one way to start off. However, collaboration with academic institutions in high-income countries can help the low and the middle-income countries in surmounting these training problems. Like large organizations like Societe Internationale d'Urologie, Endourological Society, EAU can also play a vital role. Thank you very much for your attention.